We have Sara Knizhnik. Yep. We have Sara Knizhnik, who works for the Gun Violence Prevention Initiative in Lake County as a Lake County board member in Illinois, and Jonathan Gold, who is an engagement consultant with Giffords. So, Representative Kelly, do you want to make a few comments? You're muted.
Good
Okay.
evening, everyone, and thank you, Miranda. I want to thank the ACA Consumer Advocacy for the opportunity to join you tonight to discuss our nation's gun violence epidemic. I'm honored to join so many gun violence prevention advocates who share my passion for addressing this crisis. It was more than 10 years ago that I ran for Congress because I could not stand how gun violence continued to break apart families and stifle our communities, while too many leaders in government stayed silent. The stats that you will show and we have been presented with, unfortunately are not surprising, but they're completely unacceptable. The $280 billion that we spend on the aftermath of gun violence to go to education, housing, healthcare, economic development, the things that, you just talked about. Instead, we're spending billions to literally put Band-Aids over bullet holes. And unfortunately, my colleagues on the other side have been slow to act, but this has not deterred us. I'm vice chair of the Gun Violence Prevention Task Force, and I helped lead the charge for a change over a decade. Congress passed, as you know, the Bipartisan Safer Communities Act, the first significant legislative breakthrough in 30 years, which is unbelievable. And this law included a $250 million investment into community violence intervention programs that are making historic changes by addressing the root causes of gun violence. Also proud that President Biden opened the Office of Gun Violence Prevention. So this is something that the administration is paying attention to every single day. But of course, there's a lot more to do. And I've introduced to recognizing gun violence as a public health emergency, which would require HHS and the CDC to produce a biannual report on the public health effect of gun violence. So I just want to say thank you again, and I appreciate everyone on this call who has devoted their time and passion to this issue that seems uniquely American, but we can't give up and we have plenty of work to do. So thank you so much.
Thank you so much, Congresswoman. Sara, do you want to say a few comments?
Thank you so much. I'm really glad to be here, everybody. And it's such an honor to be presenting here with Congresswoman Kelly and Jonathan Gold. I am a gun violence prevention advocate. I've been in this role professionally since 2017. In 2015, I co-founded the first Moms Demand Action Group in the northern suburbs of Illinois. And my origin story in advocacy is, I think, kind of a unique one, and one that is very special to me. The very first Illinois state bill that my Moms Demand Action Group was focused on helping to get passed was something called the Gun Dealer Licensing Act, which was focused on reducing the flow of illegally trafficked firearms into underserved communities. I am a suburban soccer mom from a community of privilege, and that was true. That was a similar description of most of the members of my Moms Demand Action Group. But I was incredibly fortunate that the first bill I worked on was one that was aimed at improving the lives of people in our underserved communities. In order to educate myself better about the issue so that I could lead my Moms Demand Action Group more effectively, I decided in early 2016 to start spending a lot of time on the south and west side of Chicago. And through that experience, I met people who were revolutionizing the approach to community violence intervention. It used to be called ceasefire, sometimes referred to as a street outreach model. And starting in about 2015, there were a lot of amazing leaders in this space that were really revising that original ceasefire model and making it more holistic. I was so inspired by the work that I saw these gun violence prevention professionals doing on the streets of Austin and back of the yards communities in Chicago that I decided the only way we were going to pass gun dealer licensing and also, in a bigger sense, address the very complex problem of gun violence prevention is by bringing communities together and helping people realize that no matter where you live, if you live in a community of privilege, let's say Oak Park, Illinois, and you want your child to feel safe in your neighborhood, then you have to care about whether or not the children in the neighboring community of Austin feel safe. And if you don't see those connections, if you can't see how gun violence, all the different types of gun violence are connected, then you can't be helpful in solving the problem. I'll just give you an example. No one is happier than I am that the US House of Representatives, including under the leadership of Congresswoman Kelly, passed an assault weapons ban in 2022 out of the US House of Representatives. And then we saw just 6 months later, an assault weapons ban passed into law in Illinois. And no one is happier about that than I am, but people need to understand that that will not end gun violence. What will end gun violence is prioritizing our efforts to end it in underserved communities, because then that approach will show benefits everywhere. And later, when I have a chance to speak, I'll go into more detail about that. But I like to tell my origin story because if it hadn't been for the grace and generosity of those violence prevention professionals in the South and West Side of Chicago, who took the time to explain to a suburban soccer mom why I had to care about what was happening in their communities if I wanted my kids to be safer. If it weren't for their leadership and their willingness to educate me, I would be a very different kind of advocate today. And so that's a bit about my story. I could go on, but I want to leave time for the other speakers to introduce themselves. And I look forward to talking to you in a few minutes.
Thank you, Sarah. John?
Hi, I'm John Gold. I'm here tonight to give you a little hope. I am a gun owner, a firearms pistol tactical trainer, an NRA certified instructor, and the NRA no longer speaks for me. They haven't for a long time. I'm also a survivor of gun violence. I have been wounded, and I have lost 4 people now in my life to firearm suicide. So these issues are, I'll start with what should be my opening line later. Justice Potter said, I don't know the definition of obscenity, but I know it when I see it. We have reached obscenity. And without practical gun laws to make us safer, we will continue farther into obscenity, as if 50,000 deaths a year isn't enough. So states with more gun laws save more lives. It's that simple.
Excellent. We'll have an opportunity for each of you to have more comprehensive comments in a few minutes. I would like to kind of frame what we're discussing today. The title of this is the cost of gun violence on the healthcare system. And we know that our healthcare system is fractured in many ways, and how the out of control gun violence epidemic that we see impacts it is critical in us bringing some of the cost under control, being able to address that and bringing some sanity back to our country in some ways. So if you'll permit me, I have a bit of a presentation to show. And before we go on, I do want to thank the Shriver Center on Poverty Law and Stephanie Becker for letting us borrow their Zoom link tonight, which was hugely helpful.
Our pleasure. Thank you for having this really important conversation.
Thanks, Steph. All right. Can everybody see that? Is it showing up
Yes.
correctly?
Yes, we
Okay.
see it.
Thank you. All right. Well, thank you for, again, joining us. Let's talk the cost of gun violence on healthcare. Why is it not moving? Oh, there we go. We want to reframe part of the discussion. We've been using the same discussion for the last 30 years on why we should get rid of guns, and we've had the same counterpoints from the gun lobbies and those who support open access to guns. So let's try reframing it and see if we can get somewhere. But look at some of these headlines. For a long time, our media and our lawmakers have solely focused on the deaths we experience from gun violence. And we absolutely should. We should have the memorials. We should have, all the stuff we do about those we lose every single day. But we cannot stop there. We must also discuss those who survive gun violence and the ongoing cost of living with traumatic injury. We must discuss the initial costs of treating gun violence, usually in the most expensive methods available in emergency departments, the mental health impacts and ongoing costs of treating them. And we need to frame part of the discussion on the absolute cost that gun violence causes to our health care system, the highest cost per capita of any developed nation. So how much does it cost us? One report says it costs us $170 billion. One study from the Journal of American College of Surgeons showed that from 2005 to 2016, injuries from gun violence cost the American healthcare system close to $2 billion. Surgeries alone cost for $16 billion of that. And that's initial surgeries. They didn't count secondary surgeries. The total of $170 billion does not include those who don't need a major surgery. In 2021, the GAO, the Government Accountability Office, issued a report on gun violence and estimated that treating firearm-related injuries cost the U.S. over $1 billion a year, and notes that costs are likely much higher than that. Public healthcare programs like Medicaid pick up most of that tab because many victims are poor and the cost falls on safety net programs. The report's based on treating people who suffer non-fatal gun injuries over the span of a single year. And 15% of firearm injury survivors are readmitted at least once after their initial treatment, costing an additional $8,000 to $11,000 per patient. Another issue is treatment access. The map you see is a map of the Chicago area, of the downtown Chicago, specific city area, and the level 1 trauma centers that are in it. A level 1 trauma center is required to have on hand all resources needed to treat and stabilize the most complex injuries, and not all hospitals are equipped to do so. The GAO report said a majority of people receiving costly medical care for gun injuries are disproportionately male, Black, and live in the South. These victims subsequently or frequently received worse treatment due to racial bias that exists in our healthcare system. And the dearth of level 1 trauma centers in areas with high poverty rates, since trauma has in recent years been seen as a high revenue source, means there's fewer options for people in the areas with the most prevalent gun violence. Following initial treatment, each person injured by gun violence is automatically seen as having a pre-existing condition. So they're dependent on the protections of the ACA. 85,000 is the number of gunshot survivors according to a 2022 Harvard Medical School report. These survivors saw a 40% increase in pain diagnoses, 51% increase in psychiatric disorders, and an 85% increase in substance use disorders than those who had not been shot. And family members of gunshot victims showed a 12% increase in psychiatric disorders compared with the rest of the public. Everytown for Gun Safety released a comprehensive cost to American taxpayers above and beyond the healthcare system that we paid during COVID. They projected the total cost of gun violence during COVID at $280 billion. So for that 2 to 3 year period. $34.8 million of that daily was medical care, first responders, ambulances, police, and criminal justice services. $47 million daily for out-of-pocket costs for medical and mental health bills. $140 million in lost work due to injury or death. They estimated $586 million daily lost in intangible costs from pain and suffering of victims and families. And about 1.4 daily lost for employers in productivity, revenue, and cost to recruit and train replacements for those lost to gun violence. Modern weapons of choice lead to more catastrophic injuries. Over the last several years, the weapon of choice among shooters in mass shootings, which are 4 or more victims, have been semi-automatic so-called assault-style weapons. These are not to be confused with the handguns in the old movies and TV shows. The sheer power of and velocity of these weapons can devastate the human body. The impact can liquefy organs, shatter bones, and amputate body parts, leading to more catastrophic injury, longer recovery times, and need for supplemental support systems, and higher ongoing costs for medical care. The children at Uvalde School had to be identified by DNA because their faces were unrecognizable because the shooter used one of these guns. The injured man in Kenosha lost his arm. The survivors of the Marjorie Stoneman Douglas school shooting did a photo shoot 1 year later showing their scars and the wounds that they'd live with for the rest of their lives. And the Washington Post recently published an expose on what exactly the bullets from these guns do. This is not for the faint of heart. The links will be active when we send the slides around to everyone who registered for this discussion today. I will not go into them on the call. Assault-style weapons have become the go-to for mass shooting perpetrators, and one of the worst, and I don't know how to say this, one of the most popular is a recently created JR-15. It's just like an AR-15 style weapon, was designed for sale for children. So it is smaller, it is lighter, and it has a less significant recoil, and it's easier to use. And it comes with cartoon skulls in pink and black, or pink and blue. And were produced here in the Chicago area for a while. I think they put an injunction on that recently, but yeah. And these are available in a lot of states at will with no waiting period whatsoever. Even with Senate hearings into this particular gun, we still cannot seem to discuss re-implementing the assault weapons ban of the 1980s. So what could the return on investment be if we addressed gun violence? What could the return on our healthcare system be? Currently, healthcare is a fifth of our economy. It makes up 20% of our national economy. In 2019, pre-COVID, health spending in the US reached $3.8 trillion. So using those numbers, if we curbed gun violence, we could help reduce our healthcare costs by 4.5 to 5% and reduce the total cost to us all by almost 7%. So in actual dollars, that's close to $200 billion that could be used to address other critical issues like education, infrastructure, clean air and water, climate change, food security, or social justice and criminal justice reform, all of which could help reduce gun violence. So we can't lose hope to achieve any lasting healthcare reform without addressing the horrific physical, we cannot hope to achieve any lasting healthcare reform without addressing the horrific physical, mental, and economic toll the epidemic of gun violence continues to wreak on our nation. To that end, we must refrain some of the discussion. If the cost of lives even isn't enough to move some lawmakers, then maybe the sheer cost to our economy may be a path forward. The truth is, it's all connected. So what can you do? There's lots of ways that we as a people, not necessarily, outside of lawmakers, but we as individuals can make differences. We've seen it happen. There are a number of nonprofit grassroots organizations committed to gun violence prevention. Most have their own perspectives, so you can find one that works for you. And each state has state-specific groups as well. Here's just a top list of some, they're alphabetical. It's not by recommendation. These are amazing groups that you can look into. So there's a Brady Center to Prevent Gun Violence, the Coalition to Stop Gun Violence, Everytown for Gun Safety, Giffords, Grandparents Uniting for Gun Safety. You don't have to be a grandparent to join them. March for Our Lives, which was created by the students down in Florida. Moms Demand Action. Safe Illinois, which Sara will talk about a little bit. It's a brand new organization. The Sandy Hook Promise, and Students Demand Action. There are many others. These are just a few. That's it. That's what we have. This is, we are ACA Consumer Advocacy. Our goal is to connect people and policy with lawmakers to make change going forward. And it. So, Congresswoman, do you want me to introduce you more formally, or I can read your bio if you want?
No, don't read that bio.
All right, I want to open the floor up to you. I know you have a lot to say, and this is one of your passions. You are, one thing I am going to let everybody know, I think you said it before, is you're the co-chair of the, wait a second, Gun Violence Prevention Caucus in the House, correct? Task Force. I knew it was one of those words. So please take the floor.
Thank you so much, Miranda, and thanks for that presentation. Yes, I'm the vice chair of the Gun Violence Prevention Task Force, and that task force actually was created right before I came into Congress because Speaker Emeritus Nancy Pelosi created it after Newtown happened. And actually, Mike Thompson, my colleague, has been the head of it ever since. And Mike Thompson is a gun owner who believes in gun safety. And a lot of times people, the narrative is they want to take your guns away. They want to take your guns away. Well, many people on the task force are gun owners. And either they were in law enforcement like Val Demings, they're hunters, or it's their hobby, but they still believe in gun safety. I have worked through the years with many doctors. We've done press conferences and have worked together, especially emergency room doctors, because of what they've seen in the emergency room. And they've really tried to lean in on helping us with passing legislation for gun violence prevention, but really it really is important, who's in the seat. That's how we get things passed, because the right person is in the seat, enough of us at the right time. That's just the, bottom line. It could be a great piece of legislation, but if people don't believe in it, so that's why it's so important for gun violence advocates to make this a priority and look at the record of who you think you want to vote for, or the type of person that you want, whether it's, federal government or state government or county or whatever it is, that we make sure we have the right people in the right seats and enough of them, at the same time. And that's why we've been able to pass some things, but then when it goes to the other chamber, we can't pass, or vice versa, because of, who's elected into the seat. What you talked about for ongoing costs is so true. It's just so very expensive. And we always talk about, as you said, who dies, but we don't talk about the people that have survived, and whether they're people that have been shot and survived or survivors' families. We just had a meeting with survivors' families a couple of weeks ago, and just listening to their plight and how they need support in so many ways, whether it's you know, financially or mental health support, or even a lot of them feel forgotten about because the crime hasn't been solved, you know, in where they live. You know, in Chicago, the rate of solving who killed their loved one or who maimed their loved one is very, very low. So there definitely has to be, you know, more work done around that. Also, the other thing we have to look at prevention. And there's legislation breaking the cycle of violence, and plus the legislation that we passed. But if we can do more work around prevention, then we won't have to deal with so many incidences of gun violence. And what Sara said is so true, you know, on the south and west sides of Chicago, we have disinvested in these communities, and we have to invest, you know, in our young people. We have to invest in neighborhoods. And it will take all of us, whether it's business, academia, advocates, legislators, it's all of us together. And businesses are not going, economically, are not going to want to move in an area where they don't feel safe, or their employers won't feel safe. So that means people in those areas, you know, they'll have to travel to shop, but also won't have the opportunity to be hired right in their neighborhood because businesses, you know, simply don't want to come. So it's so many, you know, facets to it. But, and also you talked about the JR 15, and I had someone tell me that, that someone tried to sell them a pink gun. And we have legislation that deals with how slickly, you know, guns are marketed to younger people, and to, you know, outlaw that. But there's so many things, like, you know, there's a lot of bills on the books, but we can't get them to the floor, like universal background checks. We passed it a couple of times, but, you know, it's not even talked about bringing it to the floor, closing the Charleston loophole. So like what happened in Charleston, where he shouldn't even have been able to buy a gun, but because of the law, after 3 days, they couldn't tell him definitively no, so they were allowed to sell him the gun. And then they sold him the gun, and he did what he did. And then the call came in, you know, oh no, don't sell him the gun, but it was too late. And that happens, you know, so many times. And then when I think about, you know, the number of women who have been injured or lost their lives, so many women, to gun violence. So we need to do more around that and close that loophole. It's not just about, you know, your husband, but your boyfriend or your prior partner. We have to protect women in that vein too. So there's a lot of pieces of legislation that can do a lot of things, but it's just getting them to the floor and getting them voted on and passed. That is a big part of the problem. So I thank all the advocates, because we really need your voices to continue. And I would say normally, not just when there's an event, because there's an event every day. And that's the other thing that people need to realize. It's bigger than the mass shootings. It's, you know, there are people dying every single day. And even if you die by yourself, you're just as important as those that die in a mass shooting. People have to remember that. And we have to remember not to make it normal. This is not normal. You know, it just can't be, okay, another shooting, and then we just move on. I remember listening to a parent in California, and he was saying that that's what he used to do. Oh, that happened, you know, over there, or, you know, across the country or whatever. He said until it happened to, I can't remember if he lost a son or a daughter. And that made him, you know, realize that everybody needs to pay attention, because you never know when it's going to happen to you. And none of us are safe until we're all safe. And people can see that now, because, You know, you can't go to the movies, to a concert, to church or a synagogue, or, you know, walk to the store, play in the park, ride on a bus, you know. So many people have lost their lives or, you know, been maimed because of all of those things. So, you know, I just ask people, you know, keep the faith, not to give up hope, and to please make your voices heard, to advocate in whichever way is comfortable, whether you're coming to DC or to your local state house, or you write letters, op-ed, call your local representative. Visit your local representative when they're home. If it's someone in Congress that travels back and forth, all of that counts, and all of that is very, very important. So I'll stop there.
Thank you so much. The one thing that we can all do is vote. One of
Yes.
the most important things, the important tools that we have in a democracy is vote for people who are going to actually pass these laws.
And if I could just
Real
jump back
briefly,
in
yeah,
real
please.
quick, that's what people have said. They've heard more from gun owners that don't believe in what we're trying to do. I know there's a lot of gun owners that agree with what we're trying to do, than the opposite. You know, they don't hear enough from, you know, those of us on the panel, those like us or who agree with us, and those in the audience. So like, that's what I'm saying. We need to, you know, make those phone calls, write those letters, and because people look at that, especially from their constituents.
Exactly. Guys, can you give me just a second? There's a question in the chat that I want to give to the Congresswoman, then I'll throw it over to you. Catherine wrote that she has heard that one of the main drivers of the proliferation of guns is monetary profit. And we know in a lot of cases that's true. And one of the reasons we don't make any progress is that most companies are stockholders in gun manufacturers. I don't know if most is a valid quantification, but there are definitely companies that are stockholders in gun manufacturers and retirement funds and things like that. And there are also a lot of lawmakers funded by this group of you know, firearms makers. What's your comment on that? Do you have a comment on that?
I'm not aware of how many companies are invested in that, but definitely, yeah, John might know better than me, but definitely, you know, people are donated to, and depending on the person, there are some people that have received lots of donations from different factions, not just the NRA, but other groups also. And so that's the way they vote. Some people, you know, like someone I just spoke to, and he said, you know, guns were, you know, our way of life and hunting. And I said, no one's trying to take your gun away if you have it legally and you're not trying to hurt yourself or anybody else, you know, for hunting and, you know, those kind of things. But yes, that's true that there are lawmakers that have gotten a lot of donations from various gun entities, and that I guess because they've gotten so much, that definitely, you know, influences their vote. I mean, we've had members like Gabby and Steve Scalise, you know, be shot. And but I know Steve Scalise hasn't changed his mind at all about his feelings, because I've personally spoken to him, because I said, I'm just trying to understand where he's coming from, because I work in a very bipartisan way. And he hasn't changed his mind despite what happened, you know, to him.
Okay, thank you. Even more reason why we should all be voting. So, real quickly, I'm going to introduce Sara. I know you spoke real quickly already. You hold a BA from Northwestern University and an MA from Middlebury Institute on International Studies in Monterey. Served as a university level English as a second language instructor at various universities in Chicago for 17 years before becoming a professional gun violence prevention and criminal justice reform advocate. She's served in recent years as the organizer of the Illinois Gun Violence Prevention Coalition and then is the Director of Community Engagement for Newtown Action Alliance, a national gun violence prevention organization founded in the wake of the Sandy Hook tragedy. She also served as the Director of Constituent Affairs for State Representative Bob Morgan. And she's currently the chair the chair of the Gun Violence Prevention Initiative at the Lake County State's Attorney's Office and the CEO of Safe Illinois, a nonprofit advocacy organization focused on addressing root causes of violence. In November of 22, she was elected to the Lake County Board and represents District 18, which includes Vernon Hills, Buffalo Grove, Hawthorne Woods, Killdeer, Long Grove, and Lake Zurich. She believes passionately in local government and the power of grassroots activists to build a better America. She lives in Vernon Hills with her amazing husband and 2 children. She's a wonderful person. And she also has a great kind of lunch and learn thing every other Friday about gun violence and where we are legislatively, called Honor with Action, which definitely we're signing up for. Sarah.
Thank you so much, Miranda. And I want to thank Congresswoman Kelly too for teeing me up to talk about exactly what I wanted to talk to you about today, which is the impact of advocacy. And I'm going to start by explaining why I got into gun violence prevention in the first place. Then I'm going to tell you how I got here to the positions that I'm serving in today. And then I'd like to spend most of my time talking about how we can move forward. And I have I think what in the gun violence prevention advocacy space is a little bit of an unusual view on the best way to move forward. So stay with me as I work through that little agenda that I just outlined for you. As I said at the beginning of the call, I started the first Moms Demand Action group in the northern suburbs of Illinois. And I did that because I was tired of taking my kids to school each day and wondering if that day would be the day that their school was shot up. And I know I'm not alone as a mother. I know that there are millions of people across the country that experience that feeling every day. And I'll just quickly recap. As I said, that's what got me into gun violence prevention, was being concerned about my own children's safety. But because I was so fortunate to connect with the gun violence prevention professionals who are involved in street outreach work on the south and west side of Chicago, I realized very early on in my advocacy that all of the different types of gun violence that we're dealing with are all connected. And they're not just connected to each other, they're also dependent on the root causes that create the conditions for our gun violence epidemic. And because of the generosity of those gun violence prevention professionals and their patience and their willingness to take the time to educate someone of privilege who really had no life experience with the kinds of challenges that they had faced. These are people who are usually formerly incarcerated, formerly gang affiliated, and they are the only ones that can do what they do because they have credibility in their communities and they're able to mentor people who are at risk of being victims or perpetrators of gun violence and convince them, earn their trust and convince them to find peaceful ways to resolve conflicts. This model works. We know it works. And I'm going to make a case for why this model should be supported everywhere in America, this model of preventing gun violence in underserved communities. I'm going to make a case for it by explaining my journey, how I got here, beginning in 2017. In 2017, I served as organizer of the Illinois Gun Violence Prevention Coalition, and I was hired to do one thing, which was to get the grassroots activists in Illinois motivated, and mobilized in order to pass gun dealer licensing out of the Illinois House. Being new to the field and being so deeply inspired by the folks I had met on the south and west side of Chicago, I said, well, not only do we need to break down silos within the gun violence prevention community, we need to break down silos in society at large, because until what I learned from passing gun dealer licensing is this was a bill that failed. It was introduced 14 years before I came on the scene by a state senator who represented the Austin community on the west side of Chicago, which had the highest rates of gun violence in the city, and Oak Park, which is one of the most affluent communities in Illinois and perhaps the nation. That bill failed to pass the Illinois General Assembly 14 years in a row because it was seen as a bill that would only help gang-ridden, please note my air quotes, gang-ridden communities in Chicago. And it was only when people who look like me started to, and there were many of us, not just me, there were hundreds of us across the country. It was only when people like me started telling our legislators outside of Cook County that we wanted this bill passed. That's when we finally were able to get it passed. That is wrong. That's not the way it should be. People who live in the communities that are most impacted by the illegal flow, by the flow of illegally trafficked firearms, they should be listened to just as much as people who look like me are. But at least in 2017 in Illinois, that was not the case. So what that taught me is if we're really going to end gun violence in this country, we have to do two things. One, we have to do three things. First, we have to prioritize ending gun violence in our underserved communities. Second, we have to do that by coming together across communities. It can't only fall to the people who live in underserved communities to solve their own problems, because their problem is our problem, no matter where we live. And the third thing I've learned over the years is that there are myriad root causes, including the inequitable access to public health, which ACA Consumer Advocacy is advocating for an improvement in that situation. There are many root causes of gun violence, including inequitable access to healthcare. So that is what I learned, those three things. Not just in my work advocating for gun safety legislation in Illinois, and I was heading that coalition when we passed the Gun Dealer Licensing Act into law, the firearm restraining order, and the 7-day waiting period. At the beginning of 2020, I began working for Newtown Action Alliance and did the same type of work, but at the congressional level. I sat with survivors of gun violence hundreds of times over 2 years. Excuse me, I have to take a breath. As they told the story of the worst moments of their lives to legislators in Congress and their staffers, and asked for their support for a range of gun safety bills, but primarily Ethan's Law, which is a bill that would require any gun owner to lock up their gun if a child under the age of 18 lives in their home. We were able to get all of the support needed for that bill to pass the U.S. House of Representatives in 2022. But the Congress decided not to call it for a vote. But what did happen a few months later, after in the wake of the shootings at Uvalde and Highland Park, the U.S. House of Representatives passed the assault weapons ban. Although it was not passed in the Senate and is not federal law today, it certainly helped our case to get the assault weapons ban passed in Illinois. So we appreciate the leaders in Congress for their leadership on that. But one of the things that I've learned from that experience is the leadership on issues like gun violence prevention that are kind of controversial. They start at the local level and it moves up through the state, and the last piece of the puzzle to fall is at the federal level. And that's why no matter where you are, and no matter whether you're joining organizations that's focusing on local advocacy or state advocacy, we need you, right? And know that wherever you put your energy, even if it's at the local level or the state level rather than the federal level, you are part of the ultimate goal, which is sensible federal gun safety laws. So I'm getting a little bit on a tangent there, but I'll tell you another quick story about the importance of advocacy and why I know it works. When I was director of community engagement for Newtown Action Alliance, I started something called their luncheon lobbies, which still continue today, even though I'm not in that role. My predecessor runs them now. Sorry, my successor runs them now. But in addition to passing out of the U.S. House of Representatives in the summer of 2022, the assault weapons ban, you're probably all aware that also in the summer of 22, Congress passed into law and the president signed the Bipartisan Safer Communities Act. And I'd like to tell you a little story and my perspective on when the week or the day when that bill was passed out of Congress and the Senate. The leader of the Republican, there were 10 Republican senators, and Congresswoman, it's been a long day and I'm blanking on his name right now, which I'm very embarrassed about. I believe it's Cornyn, right? Senator Cornyn led the 10 senators on the Republican side of the aisle who came out in favor of the Bipartisan Safer Communities Act. And keep in mind, this was roughly summer of 2022. We just experienced Uvalde and Highland Park, and people wanted a real action by Congress. And by this time, I had been running the lunch and lobby events, they meet weekly, and it's just advocates across the country who come together every Monday under the name of Newtown Action Alliance, and they make phone calls to all the members of Congress, hundreds of them every week. And we just kept doing it for 2 years, right? And I personally was part of the group of people driving hundreds and hundreds of calls into Senator Cornyn's office between 2022 and 2020 and 2022. And when the bill passed the Senate, something very significant happened. I heard a journalist who was interviewing Senator Cornyn, and he said, the journalist asked him, "Why are you supporting this bill, Senator Cornyn, or why did you vote for this bill and lead the charge to pass it when the gun lobby is so against it?" And Senator Cornyn responded, and he said, "I believe the gun lobby is against it because it doesn't fit their business model." And if I hadn't been doing the work I've been doing for the last 7 years, I wouldn't have noticed the significance of that comment. But what he was really saying is, we know all those phone calls are coming into our office. We noticed that people, advocates all across the country, are showing up in their elected officials' offices and district offices and in Washington. We're hearing you. And for the first time, we are more afraid of advocates than we are of the gun lobby. That's what he was really saying. And I gotta tell you, when I tell that story, I get chills, because I'm telling you, I recognize 1/3 of the names on this call. And all of those names are people that have been right here with me these last 8 years. We are winning on ending gun violence. And I don't want to discount the despair that we all feel every morning when we wake up and hear about another shooting in our community or another mass shooting. I don't mean to diminish that, but I have seen so much progress because of the incredibly courageous leadership of people like Congresswoman Kelly and so many lesser known activists and advocates across the country. If you're not signed up for one of these organizations yet, please sign up because it's working and we need you. And now I'm going to talk about, I'm going to skip what I'm doing at the local.
Hey, Sarah.
Yeah,
I'm sorry to cut you off. We have about 10 minutes left, and I want to make sure John gets something to say.
I'm sorry, John. I just want to say
No, you're fine.
I'll wrap it right up. I get kind of passionate about this, especially when I start talking about the ways that we're winning. But how can we move forward? So I've recently, within the last few months, started a nonprofit advocacy organization called Safe Illinois. And it's not focused on gun violence prevention per se, although we do support gun safety bills at the state level. It's focused on the root causes of gun violence, including ensuring equity for everyone, no matter what type of community they live in, to quality healthcare. So what I'm going to do right now is I'm just going to hit enter. And if you'll all just take a look at the chat, there are links there to what we're doing at the local level to address the root causes of gun violence, and then information about how you can learn more about Safe Illinois. I'd love to hear from any of you. I'll put my contact information in the chat as well. Thank you, Miranda.
Thank you, Sarah. I'm so sorry to cut you off. But I definitely want to hear from John, who has kind of a different perspective on some of the, or came to this from a different perspective. Let's put it that way. Is that fair? John
Fair.
Gold is, yeah. He works with Giffords as an engagement consultant. He's a pistol instructor who has protected battered women and children before trial for 25 years. He's been a member of a self-defense community for over a decade and has been active in the gun violence prevention movement for 6 years. He's also studied journalism and political science at the Miami University of Ohio. A dear friend, and it's all yours.
Thanks. There were a lot of things I was going to say today. Some of them have already been said, which is what happens to the last speaker on calls. I think I'm going to do something different. Miranda, I thought about the theme of your call today, which was the cost, the medical cost. Gun violence has cost me 3 dear friends and an associate, all have committed firearms suicide. I am a victim of gun violence myself. I have been wounded, but I volunteered for a dangerous job. And so I segmented out my trauma, writing it off as the cost of doing business. Well, today I'd like to talk about the cost of doing business. So Miranda, last night I pulled out my medical bills, all of them. And I thought instead of doing my story real quick, we can do a breakdown on what an individual pays in medical costs. So I've seen a lot of things in those 25 years, which has left me with PTSD, which I need constant treatment for. That treatment is $500 a month. That is just for mental health care. I have my benefits through the ACA because I'm a contractor in both of my positions. So I pay for my benefits. That's another $579 a month. My therapy is not covered by my insurance because they are not mandated to by law. I have chronic pain from my incident and from several major surgeries concurring, and I see a pain specialist every other month, costing me at least $3,000 a year. Coming to the GVP movement after being an NRA safety instructor has left me with a unique group of fans who like to put interesting things on my mailbox and paint things on my garage door and leave notes on my car. I am stalked. So the emotional and physical costs have been excruciating, but the monetary cost, I have to have 2 jobs right now. I can't be a full-time advocate like I want to be because I need a job that will pay for my health care. And I thought that that was a breakdown that maybe we should talk about before we do me. And now with 6 minutes left, I will do the abbreviated version of me. I came from a totally different attitude. I was a pro-Second Amendment firearms instructor who did not believe in constriction of the rights of the Second Amendment, period. Absolute. Miranda probably has bruises from some of those conversations because we stayed friends. And that's what I want to talk about today. Because staying friends and maintaining coalitions and keeping conversations going are the only way we fix this. As gun owners in this movement, we have been treated as ignorant. We are not marketed to. We are not brought in as experts, and we are. There are hordes of gun owners that are afraid to speak up because they will lose their community. Just like if you decided to get up and rebel against what you believed in, and then move to the quote unquote other side. There's a big cost that comes with doing the right thing, no matter which side you come from. And I don't think people recognize that cost. I chose to sacrifice my privilege. Sara talked about that earlier. I worked in the city of Detroit for 25 years. Half of the work I did protecting those women was pro bono because they couldn't afford to pay me. We aren't all the people who stormed Washington, D.C. We are not all the people who stormed Lansing, Michigan. The majority of us, if you do the math, there are, and it's obscene again, over 385 million guns on the streets of America. And God, are we, and I would never discount a casualty ever, ever in my life. But the fact that there were only 50,000 is miraculous because, quite frankly, there could have been hundreds of thousands. And we need to do something about it now. I came to this work not because of my trauma, but because of data. Miranda and I have a common friend. And one day I was rewriting the curriculum for my firearms students, and this woman is a curriculum designer. And she said, yeah, I'll rewrite your curriculum. And I should have known from her tone of voice it was a trick. But you're going to read all the research I send you first. She sent me 29 hours of reading. She sent me so much data, I needed 2 grad students and a shovel to get through it. And I finished reading it and said, okay. And I went to my first Moms Demand Action meeting. When I went, I heard all kinds of things about gun owners. I heard about my 15 minutes of fame. I heard about certain parts of my body that obviously didn't work. I heard that I must be mentally ill to believe in the Second Amendment. I heard all of those things. And boy, I was tempted to get up and walk out. But then my now good friend got up and started her presentation. It was the same data I had read from a different source. Well, that's research. That's not somebody's theory. That's not somebody's opinion. That's facts from 2 different places. And then it became 3 different places. And then it became 4 different places. And then it became groups like Sara's. And then it became Congress people like Congresswoman Kelly. Here in Michigan, I'm lucky enough to work with Congresswoman Haley Stevens, too, who is adamant about gun safety. What I'm telling you is I came from, I don't think I switched sides. I have taught responsible gun ownership my entire life. I have taught that if you don't have the safe, you can't afford the gun. I've said if you can't afford a lock, you can't afford a gun. I've taught responsible safety my entire career, by the way, which I was trained by an agency that I'm not going to mention on this call because they don't get publicity. The NRA no longer speaks for me. And they don't speak for a lot of gun owners. So I will end this with, I said I was going to bring you some hope. I'm it. I started on a side where I absolutely would not have heard what Sara is saying. I would not have heard what Congresswoman Kelly was saying. I did not for a decade hear what Miranda said. And like I said, lots of frustration. But I'm here now. And I have been for the last 8 years. But we all need to maintain common ground. If ceasefire and Giffords Gun Owners for Safety can find common ground, and believe me, that was a long conversation, anyone can. And we have to find common sense regulation of firearms to make these things happen. Because without those regulations, we don't have a basis to start fixing what Sara was talking about. We need a safety net while we deal with poverty. We need a safety net while we deal with inequality. We need a safety net while we deal with the borderline between suburbs and cities and between suburbs and rural places that people forget about. Because the highest level of suicide now due to firearms are rural suicides. 65% of all gun deaths in this country are suicides, and the largest growing amount of those are in rural farm communities. So we have a lot of communities to bring together. We have a lot of people to save. And the good thing is that the Congresswoman and I can disagree on something and agree on something else. And Sara and I can agree on something and disagree in something else. But this movement has to be a big tent. Because if it isn't, we won't get the job done.
Thank you so much, Don. And that's exactly why I invited you and tried to make sure we had a wide range of views, all based at the same place, but coming from different starting points. We can do this together. We have to do this together. And we no longer have the luxury of being single issue advocates or single issue voters. When President Obama left office, he said, pick your issue. But we've picked our issue for long enough and everything is connected. We no longer can sit on the sidelines and play in our own sandbox. We have to go along with all these things to make this the society we want it to be. And I know that we can achieve. So I want to thank everybody for coming. Congresswoman, did you have anything else you wanted to add? Because I don't want to cut you off.
No, but as I said and others have said, we need to make sure we vote and look at who we're voting for, that this is a priority. And, advocating is so very important, and we need you guys. You know, that's just the bottom line. And we need people with Sarah's background, John's background. You know, we need all kind of people to advocate. It's not just one person or one type of person.
Thank you so much. I want to thank all of you. I want to thank our panelists for their time and all of you for joining us. We will be sending out a recording as well as the PowerPoint presentation, and look to do another several series of these types of discussions going forward on different issues that impact healthcare reform. I did put a link in the chat. We are a rising nonprofit organization and could certainly use your help to achieve some of the goals that we have in the future. We are actually a 501c3 organization, so we are tax deductible. So thank you all. Have a wonderful night, and we will talk to you soon.